Hi everyone, I'm Lindsay from Lumino Health, and today I'm learning about online physiotherapy appointments. I'm interviewing Kyle Wong. He's a physiotherapist at CBI Health Group.
So if I'm at home and I have a new pain or an injury, and I want to know if I should reach out to an online physiotherapist, how do I make that
Mhm.
decision?
Yeah, reaching out to a physiotherapist is very simple. We are independent frontline healthcare workers, first and foremost. So if you are suffering from any physical pain or reduction in function, you can actually call right then and there and get an appointment set up with us.
Okay, so is there any difference if I'm thinking of reaching out to a physiotherapist for a virtual appointment in terms of how I make that decision or what the right conditions are?
As physiotherapists, we treat a vast amount of physical injuries, and the majority of them, I would say 95% of them, can actually benefit from virtual care. 85% of what we do and our successes as a physiotherapist are based in education that we provide and progression throughout care.
That's great. What are some of the challenges potentially with online physiotherapy and how do you overcome those?
It's about being creative, really. I think there's a prevailing idea out there that physiotherapy requires hands-on, and like I said, that kind of constitutes about 10 to 15% of our care. Whether it is assessing or treating, people feel like we need to be there interacting and feeling your body. This is untrue, right? The majority of what we get in terms of information from a patient is actually just for the conversation we have, and 90% of the improvements is associated with what the patient does day to day and how they effectively implement what the physiotherapy strategies are.
Okay, that makes a lot of sense. So if I'm already seeing a physiotherapist, how do I effectively carry out the treatment that they've given me at home?
I think the most important thing is take it seriously. As serious as if you were to attend a physiotherapy session in a clinic. So schedule it in, make sure that it is delineated in your day to day and is consistent. Set SMART goals. What do we mean by SMART? It is an acronym for specific, measurable, attainable, relevant, and timely. Creating accountability is vital too. Tell your friends that you're doing this. Tell your friends your goals. Tell your family your goals. Talk to your physiotherapist. Write it down in a journal. And lastly, make it enjoyable. You can set reward systems. So if you complete this amount of exercises a day, you get a reward. If you listen to podcasts during the exercises, if you listen to music during the exercises, doing it with a friend can actually be a big benefit as well.
So what should I expect at my first virtual physiotherapy appointment?
Yeah, this is a question we get a lot. But introduction to your physiotherapist, of course, and clarity on what we're focusing on. We will complete an assessment that will narrow down why and how your injury is affecting you. We will try to give you instructions on the first day of what you need to do at home to be successful through your rehabilitation and what items you might need as well. We will also get into some treatment that is self-directed, as we may have many home strategies to start helping you through your independent management. Just like usual, follow-ups are generally expected to make sure that progress is being made, that we are maximizing the potential for recovery, and that we are educating past pain phase to keep your injury at bay.
Awesome. So in order to demonstrate this, I'd love to just go through a couple of exercises with you.
Let's go through something simple like a squat, as well as how to lift. Okay, squat is very simple. It is functional. It is an important part of our daily activity. It's important to train. What we're looking in the squat, if you can see my feet, is having them shoulder width apart. They can be a bit wider, but no closer. And you can, I want them parallel, but you can also do a bit of external rotation if you're feeling weird in the hips when you do this. Now we're going to focus on our knees, whether they dive in or out as well. So when you go into a squat and you're seeing this, that's no good. We want the kneecaps tracking between the first and second toe. We also don't want them bowing out as you come down. So just be cognizant of that. Other important thing to note is your spine position. You don't want to be too extended out like this, but you also don't want to be too flexed over like this. You want to make sure your core is activated slightly, you have your feet properly set, And then just come on down, pushing your weight forward and having your hands forward to counterbalance, just like that. Perfect. The second thing that's important, just say you've just got over back pain and we're learning the squat, is also how to pick things up off of the floor. So what you want to make sure is, one, the weight of it. Make sure you're not lifting anything that's too heavy in your current state of recovery. We also, if you have to lift something, make sure you're close to the actual item. So when you come down, it's all set there for you. And what you need to do is keep your back straight, keep your core engaged as best as you can, lift close to the chest and keep it there, and then use your legs to power up, okay? Another thing I would keep in mind is the direction of where you're going. Just plan out where you're going and then squat in that position, and so that you don't have to turn and rotate with heavy weight.
That was great. Thanks so much. It's really interesting to see sort of how it would go with an appointment and how you can correct me and things like that.
Yeah, I mean, some really, really informative questions. Don't be shy. Ask your physiotherapist potentially to help you with the technology. So when we work with each other, there's no interruptions, so that you can be in a place where we can feel comfortable just having a conversation about your physical ailments.